Imperial has 5 sites. So there are 3 major teaching hospitals and 2 subspecialty hospitals. I think one of the problems for clinicians is that we need real-time systems. We're dealing with patients in real time.
IT is mission critical to a hospital, so all our processes depend on it, including patient treatment, diagnostic processes, and all the back-end processes such as finance and HR. There is nothing that IT doesn't touch.
In terms of strategy, we have to look at how we become mobile, how we allow session persistence to occur, how we allow the clinician to do their job in a seamless manner. It's about delivery of information at point of care. Anything, including technology, that allows us to reduce the wasted time that we have trying to collate information, most importantly trying to find that information, is of major benefit to us.
We had already packaged a number of applications in Microsoft AppV, so we thought we had the application layer reasonably sorted for the desktop, but the challenge for us was the user profiles.
I mean, we had huge issues with user profiles, often being corrupted. We had really slow login times. We had users moving sites quite regularly and they weren't getting the same experience. Over 180 group policies being applied to our desktop environment. We didn't know what policies were being applied where. We had issues with users that had local admin rights, so troubleshooting was a real issue for the team.
We needed to put together an environment that would be responsive to their needs. We wanted portable profiles, we wanted to see better performance. We were determined to make this achievable because spending the money on replacing the existing environment without the step change in performance wasn't going to get the confidence of our clinical colleagues.
It's made a huge difference. I mean, users are happy. They're able to come into work, not having to go off and make a cup of coffee, while their PCs are logging on. Everyone's really happy. They get the same experience across site wherever they go. So they're not having to call the help desk. Can you create my Outlook profile? Can you attach me to a printer here? It's probably reduced our calls by about 60%. We had 180 group policies. We've now reduced that down to 20. There's a huge appetite from the clinicians and the organisation to use newer devices, iPads, Windows 8 tablets, and that's not an issue for us anymore. With AppSense, we're also able to future-proof our migrations. Windows 8.1, Windows 10, Windows 12, it's not an issue for us at all.
The team did a fantastic job. It allows the patient experience to be focused around their care rather than the irritation of the desktop. From our experience, we would recommend AppSense, and we're a tough customer. It doesn't get much harder than deploying at a major London teaching hospital. Take the opportunity to think about your architecture for the desktop. It is important, and as much as the mobile environment is taking over, the desktop's going to be around for a very long time. A lot of your patient care depends on it. A lot of your clinicians depend on it. It is important to invest in it, design it, and provide them with a tool that is going to get them through the day.